How would you feel if the medication you needed to live cost hundreds more in comparison to other countries? I'm sure a lot of people know common medications that people may need day to day or just in general, like inhalers or insulin and other things like that. But I'm sure most people don't know the cost of these things, and a lot of the time they aren't covered by certain insurances, or people have to still pay a lot out of pocket even with the insurance, with the coverage that insurance does provide. For example, in the United States, an inhaler can cost up to like $175 or around $175, while in Britain, pharmacists are paying $20 for the same product and giving it free to patients, which is coming from Elizabeth Rosenthal from the New York Times. And today I will be speaking about how we in the United States should be thinking about switching over to a universal healthcare system. So there are a lot of different healthcare systems that a lot of different governments use. The U.S. has a mix of public and private method approaches to their healthcare system, and so there's a lot of different ones, like how the U.S. offers a single payer system to people like veterans and military personnel, and use more of a healthcare insurance model, because you need insurances to qualify for things from the Affordable Care Act, like Obamacare, and Medicaid and Medicare use parts of the national health insurance model, where the government pays mainly for the services provided. And in comparison to other countries that already have other versions of a more universal healthcare system, in 2021 it was found that 66% of Americans had private healthcare insurance paid for by work and other things like that. 35.7% had public insurance provided by the government, such as Medicaid and Medicare, and that 8.3% had no coverage, which means that they're going to be paying out of pocket for all of their services that they would need and all the medications and stuff. And that's coming from Kimberly Amadio from The Balance. And for example, Canada uses an overall national insurance system where the government pays for all the services, and also kind of use a private supplemental insurance to pay for other services, while hospitals are publicly funded. So certain things like eye care and stuff like that are paid through and supplemented by private insurance, but it's not private insurance, while hospitals and stuff are fully publicly funded. And in the United Kingdom, the National Healthcare Service, the NHS, run hospitals, and people only really need to pay out of pocket for private clinics that they want to go to, instead of using the public hospitals and stuff like that. And some benefits, I think, from the benefits of universal healthcare is that it lowers the overall healthcare costs. That can help stop problems before they get too expensive for people. That was also from Amadio. A 2011 study found that U.S. spent 4 times as much as Canadian doctors, with 4 times as more than Canadian healthcare doctors when dealing with insurance companies, because when people aren't able to afford the procedures they need, they use a lot of supplemental things that aren't addressing the real problem, and so things can continue to get bad, and so they have to keep going to the doctors to address the arising problems. And it's going to cost the hospitals more money and dealing, and the people cost them more money in the long run than just being able to have their first procedure paid for and covered, so they don't have to worry about having to go back all the time for continuing procedures. And also lowered healthcare and preventative care. Lowered healthcare and preventive care can improve outcomes in vulnerable communities. Again, kind of with the thing with, if you are able to have those procedures, even basic procedures covered, it can prevent a lot of things getting worse in the future. And again, people in vulnerable communities don't have to worry as much about having to go even for little things, so they can get all of their healthcare needs met, so that nothing spirals too bad out of control. And as well, if more people have access to healthcare, more people would have access to healthcare. And if there is a proposal in California that would provide more government funded healthcare plan, if that were to go through, then 700,000 more people would be able to have access to healthcare. And that's coming from Manvi Singh from The Guardian, and that would obviously be a big positive, because a lot more people can get all of their healthcare needs met if the government was able to cover those for that. And so some oppositional views was that chronic disease and illness makes up of like 90% of healthcare costs, and people who use it the least, or like who don't go very often, makes up like 3% of people. So a lot of people who end up paying for these services won't even be using them all that often. It's also coming from Amadio, and many people. There's also the point that many people can overuse services that they might not need because they're free or like really low of cost. So people might maybe take advantage of certain services, like waste resources and stuff. And also that there's a potential for system inefficiency and lengthy wait times, which in 2017 it was reported that a wait list for an plastic surgery was 20 to 52 weeks long, and that was by Gabriel Zif and the other authors on that from the National Library of Medicine. And that was in like other countries where the waitlisting was really long, and it has been a very common complaint of like universal healthcare systems. But I think that to go against those, that many aspects of, we already have a lot of kind of aspects of a universal healthcare system within our government with things like Medicaid and Medicare. And I think it's just like a point of kind of improving and expanding those to cover more people, so it's not just low income or people who are struggling like financially. It could be more people to get covered, because it is really important that everyone is treated. And even if a lot of people don't use those services, it doesn't hurt to have them available for everybody. And even so, there's also already healthcare models that we have, like the insurance companies that already cover other people's costs. So like you pay for insurance already covers other people's insurances. So it's already happening at a minor scale. So it would work out a lot better for a lot more people if it was expanded more. And also that letting people have access to healthcare can help minimize people needing to go for like a bunch of minor things or like repetitively go, because if they have their healthcare needs addressed at the very beginning, then they won't have to constantly go and use up resources like they would if they already don't have their stuff covered and aren't already able to afford the procedures that they need. And so in summary, there's a lot of massive benefits I think there are in changing the universe to a more universal healthcare system, such as increasing the amount of people who can access healthcare in general, and also kind of like help preventing worse things to happen to people because they have their needs met already. And I think that the US should go ahead and expand more upon the system that they already have and the things they already have in place to help expand to a more universal healthcare system, because I believe that we can all benefit from that.